Coming up on A SkinDepth Convo.
I'd say the magic is in the processing. So with Mohs Surgery, when we remove the tissue, it gets sent to my lab, which we're looking at 100% of the margin. So we're looking at it 360 degrees all the way around. Whereas the standard excision actually just kind of like slices through the specimen. So you get these little snippets of the margin, but you're not looking at it 360 degrees. You're actually only getting about 1% of the margin as opposed to 100%.
This is a show focused on educating and inspiring all those in the skincare and beauty industry. But it is also a show for those looking to improve themselves from the inside out. In each episode, we explore the latest trends, breakthrough technologies, and get expert insights within the dynamic world of skincare and beauty. If you're looking to further your beauty education and nurture your passion, you're in the right place. Renowned experts and hosts Metaxia and Francine aim to educate and inspire through their own experiences and are dedicated to enlightening and empowering enthusiasts and professionals in the realm of skincare and beauty. Join the conversation and the fun with A SkinDepth Convo. Welcome to A SkinDepth Convo. I'm Anna Kagarakis. Today we're diving into a topic that affects millions of people each year, skin cancer, and more specifically, one of the most effective ways to treat it, Mohs surgery. Joining us today is Dr. Mariam Mafee, a board-certified dermatologist and Mohs surgeon at Rush University Medical Center in Chicago, where she leads with both surgical expertise and compassionate patient care. Dr. Mafee will break down what Mohs surgery actually is, how it works, and why it's considered the gold standard for treating certain types of skin cancer. We'll also cover how to spot concerning moles, myths about who's at risk for skin cancer, including people with darker skin tones, and how you should care for your skin before and after surgery. So whether you're a doctor, a patient, or someone simply looking to take better care of their skin, this episode is full of insights that could help save lives. So let's get into it. But first, let's welcome in our expert hosts, part of the founders of Lyric Clinical, Metaxia and Francine Kagarakis. Hello, ladies. And why do you think this is such an important topic for you personally, and why is this so important to highlight in our episode?
For us, it's really our mother went through this. And for us being exposed to dermatology back in the ages, like Francine says,
in the ages?
1978, Mohs surgery has advanced and there's so many opportunities. And for us sharing this kind of information, because we deal with skin, all areas of the skin. And it's so good to educate ourselves in what are some of the procedures and some of the do's and don'ts in the industry regarding this skin cancer, which is definitely a concern.
You know, we talk about beauty of the skin, but skin cancer is the number one we should all be concerned with. So getting this information out is very important. And Mohs surgery is a great topic to talk about because it gets the fear out of understanding the procedure.
Yeah, we're really excited to talk to Dr. Mafee because she has a very impressive background. And the thing that I'm excited to highlight is a success rate for this procedure for people with skin cancer, because it's a really scary time. I mean, imagine I don't want to say it, but that's something that's so hard to hear. You talk about, your own mother and hearing the word skin cancer. That's a scary thing to have to face.
Earlier, I think about 2-3 months ago, my oldest son had a spot and it bothered me. You know how you look at something and you look at it and then finally touching it, it changed. And I said, you got to go. No, it's okay. He went and it was a skin cancer. Prevention is really important, and it hits home when it's your own family members, you know, so it's nice. Our experience, our reaching out to someone that professional as Dr. Mafee is really a good opportunity to share this information worldwide.
And understand it. It's important for people to understand power. Knowledge is power, and this becomes important. So to understand when you do get a diagnosis and you're able to understand what procedure is going to happen and the safety of the procedure and the success rate of the procedure is also very important.
Yeah, it's very important. And we'll get the expertise from Dr. Mariam Mafee herself right after this word from Lyric Clinical.
This podcast is brought to you by Lyric Clinical and the award-winning Mystique Illuminating Beauty Oil. Mystique Beauty Oil's amazing skin-friendly hydration delivers potent antioxidants and anti-inflammatories with Lyra Clinical's exclusive Mass Tech brightening technology. This luxury oil blend is infused with vitamin C for a clean, dry finish on the skin. Use by itself or add to your favorite hydrator. Beauty oil delivers your glow and go look. Contact your local Lyra retailer for additional information at lyraclinical.com.
Dr. Mariam Mafee is a dermatologist and Mohs micrographic surgeon at Rush in Chicago. She earned her medical degree at the University of Illinois at Chicago and gained advanced training in skin cancer treatment, reconstructive surgery, and high-risk patient care. She's an expert in the minimally invasive Mohs Surgery, and we're excited to learn more about the surgery from her and how it's offering the highest cure rate of any skin cancer procedure. So now I'm very happy to welcome in Dr. Mariam Mafee to A SkinDepth Convo. Thank you so much for joining us today, and I'm just really excited to learn more about this procedure.
Thanks, Anna. I'm so excited to be here and talk about it with you all.
Well, we've been very excited to have you on here, and I know that especially after the summer months and everything, this is a very important topic to talk about. But let's get to know you first. Let's talk about your story. What inspired you to become a dermatologist and specialize also in Mohs surgery?
Well, thanks for asking about me. I would say there was a lot of little moments that probably led me to this point in my career, but I'd like to say that I was one of those med students that loved everything. And I think this is something that people don't know about dermatology, but dermatology covers everything. So when we're a resident, we learn about internal medicine, so skin manifestations of stuff that happening inside your body that happen on the skin. You can make diagnoses based on that. We learn how to read pathology, so we look at what the cells look like under the microscope, which is very rare in other residencies. And then we also get to do surgery, which during my residency was what I found that I loved the most. So that's what I subspecialized in.
Wonderful. And then what are the different types of skin cancers and how are they normally treated?
Yeah, so there's some very common ones and some very rare ones. I'll kind of cover the more common ones. I think the most common one that people think about when they hear the word skin cancer is melanoma, which is sort of the big, bad, scary one because it can be aggressive. And those are those kind of ugly brown spots that can come up and we worry about spreading to other parts of the body. But that's actually the third most common skin cancer. There's two that are more common, which are basal cell carcinoma and squamous cell carcinoma. And basal cell is the most common, squamous is the second most common. Those are typically related to sun exposure throughout the course of someone's lifetime. They tend to show up a little bit later in life, especially in sun-damaged areas. So we see them on the head and neck, so areas you're not typically covering up.
Our mother actually had a squamous cell on her nose.
Oh, wow.
And so when she went to the dermatologist, they then referred her for Mohs surgery. What determines when you need to have Mohs surgery versus a different type of skin cancer treatment?
Yeah, that's such a great question. I get it all the time. And the nose is probably one of the most common spots we work on. So not surprised that that's where your mom had it. When we are suspicious of a skin cancer, your dermatologist or clinician will do a biopsy. So that biopsy gets sent off to a pathologist. They read it under the microscope and determine what those cells look like. And that will differentiate if is it normal, not normal. If it's not normal, then what kind of skin cancer is that? Right. And so they looked at under the microscope. They determined your mom's little lesion on her nose was a squamous cell carcinoma. And then at that point, it's sort of the decision tree of, okay, how do we treat this? And there are multiple different ways, but Mohs surgery is classically used in cosmetically sensitive areas where you don't want to just take a big wide margin or extra normal skin. You want to be sort of exact and focused as possible. And that's sort of the beauty of Mohs. And it's really helpful on those areas where you don't have a lot of skin, like your nose.
You know, it's funny. We started back in dermatology in the, I would say, 1978. We worked with Dr. Bruce
You always
Cohen.
have to bring numbers up.
But we learned a lot.
It's the street cred.
Yes,
right?
We learned a lot as far as there is a specialty, and your advancements in Mohs surgery and how you've advanced it, and the less scarring. I think it's such a good opportunity to kind of explain to us the procedure a little bit and tell people how good you are at it, because you're very impressive. And the fact that you're worrying about scarring, you're worrying about how the healing part of it is, it really has advanced for me. I mean, we talk about it nowhere. Before we weren't talking as much about it.
Yeah, I think Mohs surgery sort of evolved as cancer removal, and then
Yes.
and then beyond, kind of past the 70s, it started to really focus on maximizing scar outcomes and surgical outcomes for sure. So the surgery itself, we use minimal margins. So we kind of cut right around the edges of the skin cancer versus taking extra normal skin around it that's unnecessary. And the reason we do that is because the beauty of Mohs is how it's processed. That's what makes it kind of different from standard surgery excisions. When it goes to the lab, and the lab is my lab, so I control sort of where the tissue goes. I have a tech I work one-on-one with every day, so he orients it and inks it exactly how I ask him to do it, and then he cuts it and processes it for me. And so I look at it under the microscope. And what makes Mohs so special is we look at it 360 degrees around. So I look at every edge of the lesion, all the cells around, underneath, every which way, which is not typically done in your standard excision. And if there is something positive, meaning there's still cancer cells left, I've mapped it in a way where I get to go back exactly where it's located. So if you think about like a clock, if I say, hey, there's some left at 3 o'clock, I'll go to 3 o'clock and I'll take some from there, and I won't mess with the rest of it. So it allows us to take as minimal tissue as possible, therefore leading to a smaller scar.
So cool. So cool.
So great.
I think it's very cool.
I remember something when the doctor said about margins. You're sort of seeing the margins and how much tissue you need to remove.
Yes, exactly. You can be very focused and exact about what you're taking, and you're really letting the microscope track out where it is. I think some people get really discouraged when we have to go back and take a little bit more. But I always tell them, like, this is because I'm just curving around the edge of your cancer, right? Like I'm right up against it. So me missing a little edge here or there is very likely to happen. And we just track it out and follow it out so that we can take as least as possible.
Yeah, it's very thorough.
Yeah,
I have a question. What's the youngest patient you've actually done Mohs surgery on?
Oh, that's a great question. I just had a 29-year-old.
Oh, wow.
This past week. I have worked on someone in their early 20s. I want to say 20 or 21. But certainly there's some people who just so happen to get skin cancers early on. They may have risk factors like, I had a young guy who I did a basal cell on his neck, and he happened to have radiation to the area when he was a kid. And radiation is a known cause of basal cells years down the line. So that wasn't super surprising. And then there are some people who have syndromes or genetic syndromes where they develop skin cancers really easily. And then sometimes there's just like unfortunate luck of the draw, just someone really young who's had bad burns and things like that, and we happen to find a skin cancer on them.
I mean, how much of that is also, when you talk about the different factors like family history, things like that, how much does that play into it?
It definitely can. I think melanoma more so than basal and squamous, but I will say your parents gave you your skin type, right? So like people with more melanin, more pigment in their skin are more likely to fight off the radiation from UV rays as opposed to someone who's very fair skin, like, classic Irish skin, for example, they get a ton of skin cancers just because their skin can't fight off the sun rays as well. So if your parent has really fair skin and you have fair skin, then, you're going to be more prone to it as well.
But there's a misconception about darker skin types don't have skin cancer. And I'm finding out that's not true. Can you kind of tell the audience what's your thought about that?
Yeah, I think that's totally true. Definitely a misnomer. Dark skin don't need sunscreens. Dark skin individuals don't get skin cancer. We definitely see them much less frequently in those skin types, but we certainly do see them. There can be various risk factors with that as well. But like, for example, one uncommon type of skin cancer that people don't think about is with melanoma can occur under your nail. You have skin under your nails. So it can show up under your nail. It looks like a dark streak. That is one of the ones that can be more common in darker skin folks. So everyone's looking at their nails now. I don't know if you got nail polish on, but take a look. I always tell my patients, we look at your nails when we do skin checks, and if they've got nail polish, I'm like, hey, next time you take your nail polish off, just look for any brown streaks just to make sure it looks okay.
So what do people do when they're getting gels or they're getting any type of dip or some type of nail They need to keep an eye on it a little more? Or?
It doesn't necessarily increase their risk, but it definitely makes it harder to monitor, right? Like you can't see under the nail to see if there's streaks there. So I always tell them, like, whenever you have that moment where they're taking it all off, like look at all of your nails, or come in one day when you just happen to not have all your nails done, so that your dermatologist can look at it. But just at least like once a year, I tell people just get a good look.
I was thinking a full body scan, not even my nail.
Yeah, that's part of it. Yeah, I know. It's like one of those things that people don't think about.
Yeah, I've always been somebody who's very, very, proactive when it comes to getting the body checked. I've had 2 moles removed. Luckily, they weren't cancerous, but I've gone in to get it checked often. And I had a friend recently who told me that she goes in almost every year when she does her checkup. She's like, hey, I want to go to my dermatologist, get checked. And her dermatologist looked at her and says, why are you back in here? She goes, well, I don't want to see you till you're 50.
Oh,
and she just turned 40. So I was kind of surprised by that. But how often should you be going in your opinion, to get checked? And are there any reasons maybe someone should get checked more or maybe less?
Yeah, that's a great question. And maybe she got that response because technically there's no standard guideline of how the average person needs to be monitored. And that might be where that comes from. And I'd say 30 and up, I always tell people maybe just get a good baseline. If you don't have a lot of moles, you don't have a lot of risk factors, I'm not telling them to come in every year, but maybe every couple of years just to kind of check everything out. And then it's a good opportunity to just educate them on what to look for, what's normal, what's not normal. I'd say if you have a history of skin cancer, we typically see you more frequently. So if you have a history of a basal or squamous, we say every 6 months for a few years and then every year after that. If you have a melanoma, it's a little bit deeper. We say invasive melanoma. We usually see you every 3 months or so. So it's a little bit more frequent. But if you have something like family history or some sort of risk factor, like a common risk factor, someone who's immunosuppressed, so someone who's on medication that suppresses their immune system for like an autoimmune disorder, for example, that's someone I'd say, hey, let's see you once a year, because we know that they tend to also get skin cancers more easily. So kind of depends on your history and your risk factors, but I'd say it never hurts to get one, kind of like a baseline one down, and then kind of have the dermatologist guide you on what would be appropriate for how frequently you should kind of check in.
Going back to Mohs surgery, let's kind of go back to the different parts of the body. I know you said the face is great for it. Are there certain areas where it's more effective than others?
I'd say it makes sense in certain areas that are exposed. So like your face, back of your hands where you just don't have a lot of skin. Another common place we do is on the shin, because you can imagine like right over the shin bone, the skin is real tight and taut over there. So the closure becomes complicated then. So we often use Mohs surgery in those areas where the skin is just very minimal and hard to close. So back of the shins, back of the hands, genitals, we work on the genitals, hands, feet, all that stuff we tend to work on, just because it can be a more complex closure otherwise when you're taking wider margins.
When we've had moles in our family, and I've actually had a couple more removed too, but what is the signs? I think it's important. They're out all over the place. What are some of the signs that you could tell our audience that you should look for and question and go to seek some professional help? What would you recommend or suggest?
Yeah, what to look out for.
Yeah.
I'd say anything that is not healing or kind of bleeds on its own is a common side effect or sign of basal cells and squamous cells, because they tend to kind of destroy the surface of the skin. And so then the skin kind of bleeds or gets kind of weepy more easily. I'd say anything that's changing. So a lot of people really know their bodies. They've never had a skin exam. They come in and they go, this is different. This is different from all my moles. Like, listen to your intuition on that. And something that's growing rapidly. So again, changing, growing is really important. As far as like melanoma goes, I think there's a lot of education out there, so people are pretty savvy about it, but things with multiple colors, things with kind of jagged borders, or some things like perfectly circular round, less so, but if it's kind of jagged borders, kind of asymmetric, those are things to look for. But essentially something that's changing, we always definitely want to check out.
How will sunscreen? Do you talk to your patients a lot about sunscreen?
Oh, yes. Probably more than I'd like to sometimes. It's like dominates my day. I say definitely. So I'm a big proponent of sunscreen, but I'm actually even more a proponent of sun protective clothing and just kind of trying to cover up as much as possible, because sunscreen is wonderful and it works great, but it's not perfect, because people will come and be like, oh my God, I'm using 70 SPF. I kept putting it on, I still got burned. It's not a perfect product. But covering up like some clothing, especially if it's a thicker clothing, if it's more like a tightly woven fabric, if it's a darker clothing, so like a white t-shirt versus a black t-shirt, will actually block off the sun rays better, meaning the black t-shirt will. And so as much as people can, I tell them to cover, wear hats, seek shade when you can, but there's also stuff that reflects off of water and cement and things like that. So you're still getting sun that way. So for those areas that you can't cover up or don't have covered up, then yes, I would say please use sunscreen. So face is part of my regimen every day. In the morning, I put sunscreen on, because even you go out a few minutes every day, it's worth it to have the sunscreen on versus being like, hey, I'm in my house all day, but then you kind of are in and out. Some people kind of have that mentality. Say, just put it on, make it part of your regimen.
Well, Metaxia is known now for putting her sunscreen on her hands when she's driving.
Yes. Yes. I mean, where are you guys? Are you in California still?
California.
Yeah.
Sunny California.
Oh, yeah, you have to. My parents are in San Diego, and even when I go out to visit, I'm like, oh my God, my hands, they're already getting tan. You cannot avoid it. Yeah. For sure.
So,
driving gloves are great.
That's what she wants. She wants to get the driving gloves.
She needs to get the driving gloves. I encourage it. Yeah.
She's smart.
Yeah.
It shows our age, and we're constantly trying to slow down the aging process. And the hands, we forget, and that it is that intermittent of running to the store, 10 minutes here, 10 minutes there. It accumulates to the aging. So yes, I do cover up.
I get nervous now whenever I get in the car. I'm like, shoot, I forgot sunscreen. I put my hands on the lower part of the steering wheel. It's like, oh gosh, no sun.
Don't do 10 and 2. Don't do 10 and 2. You
no,
do
right?
I don't know, 5 and 7.
She's known for covering her hands with her sleeve.
Yes, yes.
There's
all that athletic wear now that has like the little thumb hole. So I use that sometimes, cover up your the back of your hand, put your thumb through.
See, I need to start doing that.
We hear about it, but you still see people say, yes, I know about it, but then they forget to wear their sunscreen. They forget to cover up. They forget to do this. And during the summer, you see the damage now in the fall.
Yeah.
In the fall, you start seeing what's going on. Do you see more patients in the fall after they've come back from vacation or they've been out in the sun a little more?
I feel like I see more patients in the summer for some reason. For whatever reason, just in medicine in general, summer months tend to be more busy. I see people in the fall because they're about to meet their deductible and they're like, let me get into the doctor.
Smart.
Yeah.
That's smart.
I think people try to avoid coming into the dermatologist when they're burned or like super tan because they know we're going to yell at them probably. So honestly, I don't think that's what ends up bringing them in, is when it's like at the end of summer. I don't think they like have summer and then think, oh, I need to go into the dermatologist, but it probably is a good time for them to come in.
I have a good question for the estheticians in the market. Okay, you get Mohs surgery on the face. What is the time frame, or what do you suggest them coming back and getting a facial or a treatment? Because there is healing. There is healing within that we don't visually see sometimes. And so what would be a good time frame that they would consider going back to their esthetician or get aesthetic treatment?
I would say as long as everything is sealed and healed, so nothing's open, weepy, that would be number one. I probably would wait a good 6 to 8 weeks, just because a lot of times when we stitch their wounds closed, they have deeper sutures that are under the skin that dissolve on their own. And sometimes I find that when people manipulate those within the first month or so, they get these spitting sutures. It kind of like comes to the surface and creates a little like pimple-like lesion. So I usually tell them to avoid that stuff for a good month to 2 months. I would say for things like lasers, that we know like early intervention is great. So that I don't have as much a problem with, because it's not as much sort of like rubbing and things like that. But I'd probably say a good 2 months is like very safe.
Very fair.
Okay.
Yeah.
What about before you go in for a Mohs surgery? Is there anything that you should do to prep your skin to get it ready for surgery?
There's not a whole lot that I actually have people do to prep. The only thing that, and I don't do this, and sometimes we do it for cosmetic stuff. So people who have darker skin tones, they tend to hyperpigment, as I know you gals know a lot about hyperpigmentation. And sometimes before cosmetic treatments, we'll have them use like a bleaching agent, something like hydroquinone, for a few weeks before we do some procedure or cosmetic treatment to prevent the hyperpigmentation. But honestly, I don't do it for the Mohs surgery because I don't want to cause any irritation to the skin, because then when I go to cut and read it under the microscope, it can really affect what I'm reading under the microscope, like the cells. And so I just don't want it messing with that.
I can tell you Mohs surgery has caused less hypopigmentation because what you're doing is stitching it up and working around it in a way. So I've noticed that the hyper could be a consideration, but hypo has definitely lessened because of the darker skin tones that I've seen.
Yeah,
which is really interesting.
I think there's just a like we were mentioning, you were saying like in the 70s and on, they kind of focused on surgical technique. I think most surgeons have really excelled in the technique of suturing and making sure that skin is very gently handled, making sure that they're doing everything possible to maximize the cosmetic outcome. And I think that really helps. I agree. Yeah, you can also get hypopigmentation, which is like lightening of the skin, and that's really hard to fix. It's the hyper that's almost like a little easier to do things about.
And then also after you're done with getting Mohs surgery, is there something that you can put on your skin to help it heal faster or things like that that you recommend for your patients?
Yeah, I usually recommend for my patients in the acute phase petrolatum jelly, so just Vaseline, good old Vaseline. We've done some studies on that in the Mohs literature and then found that that works really well, especially better than like antibiotic ointments, for example, because a lot of people want to put that on there. For after they get their sutures removed, I usually recommend a product with silicone in it. That studies have shown us provided some benefit for scars.
Oh, fantastic. And dimethicone and silicone, nice base.
Yeah, it's good.
Yes, feels good, looks good. It kind of rubs in. If they're on the face, I have them use a gel so that they can put sunscreen on top, makeup on top, but you can't really see it. It works really well.
Or sunscreen with some silicone or dimethicone. Okay.
And then this is an outpatient procedure, correct? Is that outpatient, or how does it work? What does it typically look like when a patient comes in for Mohs surgery?
Yeah, it's an outpatient procedure. So we do everything under local anesthesia. So we don't put the patients to sleep. Someone's super nervous, we'll sometimes use an anti-anxiolytic, like a pill that can kind of help calm them down a little bit. But honestly, most people do fine without. And then they come in, they can eat breakfast. They don't have to fast, which is nice since we're not sedating them. We typically don't stop any medications, maybe rarely a blood thinner, but most of the time we keep everything going, and we just tell them to come and just expect to be with us for at least a couple hours, because it does take about 45 minutes or so to process the tissue. So remove the tissue, process it, and then time to stitch it. So they're with us for a couple hours.
As we've said, what is it that makes Mohs surgery so effective? Why is it such an effective procedure for skin cancer?
I'd say the magic is in the processing. So with Mohs surgery, when we remove the tissue, it gets sent to my lab, which I am in constant communication with my tech. He's processing it how I want him to, and I'm reading the slides. So I kind of have full control over every step of the process. And then we're looking at 100% of the margin. So we're looking at it 360 degrees all the way around, whereas the standard excision actually just kind of like slices through the specimen. So you get these little snippets of the margin, but you're not looking at it 360 degrees. You're actually only getting about 1% of the margin as opposed to 100%. So it's not a lot. Yeah.
I think once a patient understands that, okay, now we're out of danger because we've taken care of it, the second thing we're worried about is scarring.
Totally.
So I'm hoping, okay, second thing, not first. It should be the second thing. So once we're okay, now we know that this procedure is going to make sure we have less scarring. I think that's what I noticed with my mom, number one. There was less scarring. It didn't look so, there's no scarring at this point. And so she's able to go ahead and wear her sunscreen, her makeup, and there is no sign that there was anything done.
That's great. I'm so happy to hear that. Yeah, a lot of patients come in and are like, I don't care what the scar looks like. I don't care what the scar looks like. Just get the cancer. I'm like, no, that's how you feel right now. But once it's out, you're gonna be like, but
Yeah.
wait, what about the scar? So we try to
So
counsel
true.
them on that because it looks a little scary at first. I don't know about your mom on the nose. You're like, whoa, that's way more stitches than I
Huge,
thought.
yes, yeah,
Yeah, you put a couple stitches on a nose, that's enough to look like a lot.
Oh, and a Greek nose, yes, absolutely. Okay.
Hopefully she maintained her nice heritage afterwards, but yeah, I think people are surprised by what it looks like afterwards, but then as time goes it heals really nicely. So
You have such a high success rate with this surgery that I really want to put that on the podcast. Your success rates are over the chart. They're huge. Their numbers are high, which is really good. So you're doing so well as far as, recurrence. I mean, I find more people doing the Mohs surgery don't have to worry again. Just, keep an eye on their skin and be thankful that you got all the margins and you had clean margins and you did that extra. Because it is extra. It is extra time. It is extra effort. And your eyes are really tuned to that area, which is so cool.
yeah, I'm really grateful that we have the best success rate of all the procedures for skin cancer. It's 99% for basal, 98 for
Wonderful.
squamous.
Yes,
So,
Wow, those are great
that's
numbers.
as good as you can get. And there's no guarantees in life, right? But that's as good as you can get.
And especially when it's an emotional time for everybody, like Metaxia is saying, it's such an emotional thing to hear.
Yeah.
You have skin cancer, let's deal with it. But to know that you have that high of a success rate has to really be so incredibly helpful for these patients.
So cool. So good. I mean,
think it does offer
congratulations.
a lot of sense of ease for patients when they hear that.
Yeah. We need more doctors like you.
Yes,
You're
definitely.
awesome. Thank you.
And very happy to be able to share this information.
Yes.
It's not complicated when you have the right person doing the procedure.
Yes,
And
exactly.
And the passion. You come across with the passion, and that's what's really important because, it is a bedside manner, and you're so calming, and you're so calm in how you explain it and reassuring. And I find myself dealing with a lot of people who have exposed, oh my God, I have cancer, but it's the way you approach it and, the confidence that you have with the procedure. I think it helps because my oldest son also had a spot right here in the cheek. Oh, mom, it doesn't mean anything, and sent him to the dermatologist and was very thankful. So I think we need these kind of podcasts to share that it could happen to anyone, any age, that we be aware of, and more education is what we need in the industry. So thank you for your time. It means a lot for me because my son and my mother both had that situation, and I don't want anyone else not having the opportunities that we've had.
And everyone should be paying attention.
Yes.
Everyone should go see their dermatologist. Make sure that they're noticing differences and noticing exactly what you were saying about any type of lesion.
Totally. You're preaching to the choir over here. I love this. Can we just put this on like a national television and broadcast this? I love it.
We just need to educate everybody. Where can people find information if they want to find out more about Mohs surgery, maybe with talking to you, maybe? Where can people find more information?
There's a couple of great resources out there. For me personally, I work at Rush University in Chicago. So you can always find your way to the Rush University website. I'm on there, have my own profile and some info pages about Mohs actually. And then nationally, there is the American College of Mohs Surgery. It's the ACMS. I'm a fellow of the ACMS, and they're sort of the leaders of Mohs surgery in the U.S., and they have some great videos and resources for patients. I think that's a really great resources as well.
Well, we appreciate you coming on and talking about all this and giving our audience all this fantastic information. But before we go, what's your number one bit of advice to our audience?
Wear your sunscreen.
I love it.
There's so much I could say.
I know. Well, you gave a lot of information today. A lot of great
important information. Very important information. And getting the word out is all of our jobs. We have to make sure that people understand. Get in there, take care of it. The faster you take care of it, the better it is. This is great information for everybody to practice.
Yes, I couldn't agree more.
Perfect. Well, thank you so much, Dr. Mafee. We appreciate you having you on today, and we will talk to you soon.
Thanks so much.
A big thank you to Dr. Mafee for joining us today. And you can learn more about her and the procedure at Rush University's website by going to rush.edu. Then click on the Doctors tab to find Dr. Mafee. You could also see Rush's social media. You go to @Rush Dermatology. They have a great social media page with some wonderful information. I love this interview. I think it was fantastic. A lot of great information. What was your takeaway?
My takeaway is that you do need to see your dermatologist. You need to get your skin checked. And it's very important to wear sunscreen when you're young and continue wearing sunscreen, and understand even clothing is very, very helpful.
Yeah.
You know, the fact that you're wearing sunscreen with silicone or dimethicone, she said how that is very important. So special formulations are important when you're dealing with sunscreen, and understanding how to reapply, because skin cancer is something that we have to look for.
And for me, Anna, is really understanding that, we need to protect our skin and not overexpose it. Sun protection is really important, this clothing that she mentioned, but really understanding that you don't want your skin compromised. Too much of anything is no good. Being aware it's not just the summer months you have to worry about your skin, it's all year long. Keeping an eye on changes. It just was really, for me, reinforcing what I already knew, but really kind of making me feel that this was a very good topic, a very good choice. Thank you, Anna.
And all skin types, very, very important. Do we have to remind everyone?
It is. It is very important to remember that all skin types, we say it over and over again, because unfortunately there are a lot of people who still don't know that, or don't know how much the sun could damage our skin. And then we've talked about it before in past episodes, where you have people who are going on social media saying not to wear sunscreen, or talking about how they make their own sunscreen. And, to me, I cringe a bit, just because we know about it. We've been discussing it, and there's a reason why we're discussing it, because it's so important. And you hear about, younger and younger people who are now facing skin cancer for different reasons. So it's something to keep an eye on, definitely. And hey, Metaxia, I got to tell you though, she did say to wear your driving gloves.
I know she did. She did.
Yep.
She did. I mean, I'm going to go buy a pair. I think it's especially.
I'm going to take a picture.
I think we should all.
I'm going to take a picture.
Okay.
But sunscreen, what she said too, is that it's important to understand the drug facts. Sunscreens are, they verify the number, the SPF number, and the, clothing. So I'm going to go buy some gloves and have them in the car, because I always have sunscreen in the car, but I think clothing is also another additional, safety net. So driving gloves for me.
Yeah,
she said
get those driving gloves ready.
Dark color gloves are better.
Dark color clothes.
Dark
with me with the black.
clothes,
Yeah,
yes.
I think that's a good thing. Yeah.
I always thought it was the
gloves.
opposite.
Yeah.
I always thought it was the white, because I always thought white reflected the light. So I learned something new with that, because that's what I would have naturally had gone to the lighter colors rather than the darker colors.
No, darker colors.
No white
colors. Yeah.
No white gloves. That's okay. It's kind of cooler. I kind of like the black gloves. They're cooler.
Black leather.
I need to get the sport ones.
Yes.
Like you're driving a motorcycle.
Yes.
You're getting rolling. Also, that was a lot of great information today. And also, since I have you here, big part, Lyra Clinical, I know it's really important. Sunscreen's a huge, huge part of, it's something that's very important. One of the number one things you say to leave with when it comes to going to your esthetician. Do you have any certain sunscreens that you want to talk about that you kind of think, after hearing about Mohs Surgery, that you'd like to let people know about?
I like to remind people sunscreen's not an option. It's something you should be wearing. It's not something, I'll think about. And don't count on only wearing sunscreen in your makeup. You have to remind people that you're protecting your skin, and sunscreen has other benefits. If it's formulated correctly, there's so many more benefits you can get, but protection is number one.
And I think the choices, we have different choices of SPFs. You have the oil-free, you have the hydrating, you have choices. So find one that you like, that your skin likes, and be consistent with it. We get stuck that we think SPFs are one type of delivery. There's so many new deliveries on the SPFs. Take advantage of that. And pick the one that works.
Exactly. Yeah. And if there's a higher Fitzpatrick, it's probably better if you use one of our tinted, because we do use high amounts of zinc oxide in our products. But it makes a big difference to make sure that you reapply when necessary. Which is always, especially when you're out in the sun or if you're out, period.
Yeah, so if you're out, definitely find the sunscreen that's best for you. I mean, for my kids, I give them the oil-free one. I like the hydrating. I also like putting a BB on every day because I love how that feels on my skin. But usually for me, because I have drier skin, I always do the hydrating SPF. Also the Elio drops. I love those as well, too. So those they're great and it's easy to put on. And I feel like it covers really well. And that will do it for us today. Make sure to subscribe to A SkinDepth Convo on any of your favorite podcast platforms like Apple Podcasts and Spotify. You could also watch the show on Spotify and on Lyra Clinical's YouTube page at Lyra Clinical. And make sure to follow A SkinDepth Convo on our social media channels. You can find us on Instagram, TikTok, Facebook, you name it. Just go to at SkinDepth Convo. And if you have any questions for Francine and Metaxia, send us an email at info@skindepthconvo.com. That's info@skindepthconvo.com. And thank you all for joining us today. And a big thank you to Dr. Mafee for all the incredible information and for all of us at A Skin Depth Convo. I'm Anna Kagarakis, and we'll talk soon.